Hello, and thank you for joining us today. My name is Carla Legria, Project Manager with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar, the core curriculum on creating accessible, culturally responsive, and trauma-informed services, strategies for training and implementation, will be moderated by Cathy Cave and featuring the following panelists: Stephanie Love-Patterson, Rachel Cox, Alex Champion, Brandy Walega, Miranda Encina, and Jessa Winus. Before we get started, I would like to go over some technical details of the WebEx software that we'll be using for today's webinar. Please be aware that your screen might look a little different if you're using a Mac or PC. On the right-hand side of the screen, there are multiple boxes. Towards the bottom is the chat feature. You may have to click on the chat cloud icon at the bottom right of your screen to open the chat box. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the presenter if you have questions regarding the training content. You may contact me if you have questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You'll see a lot of options, but for this session, you'll want to select everyone if you would like to respond to a question from the presenter or to contact center staff anytime during the session. You should click on me, Carla, to privately contact us if you are in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on everyone, type in where you're calling from, and then press enter. Perfect. Thank you all very much. Well, you could get a lot out of the chat feature. There are times when it moves really quickly and it can feel distracting. If this is true for you, feel free to minimize the chat box by clicking on the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there's a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word Media Viewer, the same way you might if you wanted to hide the chat box. Time permitting, we will moderate a Q&A towards the end via the chat box. And at the very end of the webinar, you'll be taken to a brief survey. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes sound cuts out due to internet connectivity, so feel free to call back in if that's a problem for you. If you're experiencing technical difficulties and are unable to contact me, you may contact WebEx tech support to resolve any issue. That phone number, which I'll post in the chat box, is 1-866-229-3239. Again, thank you all for joining us today. I'll turn it over to Cathy.
Hello, everyone, and thank you. We are going to have a conversation today about the core curriculum on creating accessible, culturally responsive, and trauma-informed services. Our panelists today are all from programs and coalitions that have worked with our materials, that have used the core curriculum, and some of the additional toolkits and other resources we have available. So I wanted to take a moment and share a little bit with you about what the core curriculum has in it, and again, and then we'll hear from our panelists about their experiences and the way that they've used this in their programs and in their states. So as it stands right now, the core curriculum is 7 modules. So the first 4 are about kind of understanding trauma. So our integrated approach is a way that the National Center on Domestic Violence, Trauma, and Mental Health has looked at and talked about what it means to be trauma-informed. So that beyond a buzzword, we're really thinking about how do we incorporate a human rights and social justice lens, how do we think about the context of culture and historical oppression and what that means for survivors and staff and for our experiences in doing this work. And we also think a great deal about how to have everything that we do and that we promote be survivor-driven. So from how program staff and survivors interact to what kinds of resources we develop, really centering survivor voices and focusing on relationship and hope and resilience. And so the first module, the core curriculum, covers that conversation. Module 2 is about the impacts of trauma. So what it means to have a trauma response, what does that look like, what does it feel like, what's that experience, and how survivors are impacted by trauma, and then also how trauma impacts the ways that survivors interact with the services that and supports that we provide. And so again, always wanting to come back to what's the survivor experience, and then how do we make sure we're supporting folks in the best possible ways. Module 3 is about the impact of trauma on advocates and advocacy, or on those of us who are doing the work. So what we know about being trauma-informed, it's not just how do we create environments and services that are helpful to survivors, but how do we look at what are the needs of staff, what are the needs of everyone who's doing the work, and how do we create whole environments that are focused on well-being and nurturing each other and caring for each other. And then Module 4 is about creating inclusive environments, services, and organizations. This is from studies that we've done at the center, reports that we've created, and really come to some hands-on practical guidance around if you're wanting to change your services, enhance the way you operate, really center relationship and resiliency, then these are the resources that will support you to do that. Modules 5, 6, and 7 are what we call the specialty modules. And so Module 5 focuses in on supporting children, supporting parents and families as a whole, so that as we're working with survivors and their children, we're thinking about how do we hold everyone's needs in mind at the same time. Module 6 is about supporting survivors experiencing mental health challenges, emotional distress, and crisis. And Module 7 is about trauma-informed advocacy for survivors who use substances. So when we spoke with programs from across the country during the development and the creation of the core curriculum, these were the themes that kept coming up for folks in terms of what makes the work challenging. And so what we centered on was supporting families, mental health challenges, and supporting survivors who use substances. And so without much further ado, I want to give us an opportunity to hear from our very first panelist. So from Connections for Abused Women and Their Children, we have Stephanie Love Patterson, who's the Executive Director. And Stephanie, go ahead and share with us your program's experience and history with working with the National Center on these topics and how you all use this information as a staff.
Well, thank you so much, Cathy, and thank you to everyone. I am Executive Director, as Cathy mentioned, of Connections for Abused Women and Their Children, CAWC for short. I've been with the organization for 21 years, 7 years as Executive Director. And just to give a bit of history on the organization, CAWC is the oldest domestic violence organization in Chicago, where we started the city's first 24-hour domestic violence shelter and hotline. We also have medical-based services at Stroger Hospital, Northwestern Hospital, two big facilities here in Chicago. And then we're at a relatively large substance abuse treatment center called Haymarket Center. And then we're in the Humboldt Park area, which is one of the larger communities, again, here in Chicago, and one of the neighborhoods. We do, in addition to direct services to victims and survivors of domestic violence, we do a significant amount of training and outreach to a variety of entities so that we can, not with the expectation to make them domestic violence experts, but just to know how to have conversations with, for instance, if it's a police station or if it's another social service agency or healthcare institution, but how to have conversations about domestic violence with individuals that they are talking with, and to use CAWC as a resource. What's interesting about working with the National Center is that CAWC was introduced to them very early through our hospital program at then Cook County Hospital. So I've known Dr. Carol Warshaw for a number of years. In fact, all the 22 years or 21 years that I've been at CAWC, and we kind of started in on the ground floor with them when at that time they were known as the Domestic Violence Mental Health Policy Initiative years and years ago. And so it's really been a great partnership between the center and CAWC in terms of back in those days, just having conversations between domestic violence organizations and some mental health organizations during a time when people were afraid of those conversations on both sides. If we had longer, I could talk a little bit more about that fear and how the center really bridged those gaps to the point where domestic violence agencies weren't afraid to make referrals to mental health organizations or to use some of the same language and vice versa. And so it's really been a great partnership over the years. CAWC, so we've been a fan also, I should say, for all of those years. Our staff size is about 39. We have about 3 part-time individuals. And just kind of to talk about a summary of our training approach and overall plan and journey with our staff is exactly what this is about and what has been mentioned before, culturally competent approach to doing the work that we do here at CAWC, and really to be comprehensive to meet the needs of the clients that we serve. Particularly during this time, I reached out again to Carol, and that's when I met Cathy to help with our staff to work with our clients as they were going with the dual pandemic of domestic violence and this and COVID-19 and the whole mandate to shelter in place. I noticed that when I was doing our check-ins, I mentioned we have a shelter and the shelter never closed, but for some of our satellite offices, we went virtual. And I just noticed when I'm looking at the screen and I'm doing check-ins, there were some challenges. Some were spoken during the check-ins and people were comfortable enough to share some of the struggles, and I could tell some were not. And some of those related to the isolation that COVID caused. Some of them were related to some of the riots that Chicago experienced as it related to George Floyd, and so many other things that as they were worried about themselves catching COVID, their family members, and on top of all of that, just having to help individuals who still were facing domestic violence. A lot of times people thought that, well, domestic violence would end, but no, the numbers increased, unfortunately, dramatically during this time. And so I reached out to the center for help with those trainings, and again met Cathy Cave and went through 2 sessions of trainings with the staff, and it was just really eye-opening, I think, for many of them, and just really, really the curriculum helped to create a perspective that a lot of our staff just didn't think about. So we had 2 sessions, as I mentioned. About 29 staff were able to attend, and I believe each of those sessions were for 1.5 hours. Some of the things that were really, really helpful just in terms of some of the strategies and concepts that Cathy talked about, was just to remind everyone to breathe, which sounds so simple. And so, like, of course we're breathing, but to really be intentional about it, and to sit comfortably and just remind ourselves to, like, be really present as we were taking those much needed deep breaths. And this, the importance of movement and just making small adjustments in our workday, because sometimes when you're sitting at computers, as sure as everyone knows, on the screen, you can feel like you're just stuck in a situation. And imagine that as you are working with a victim or survivor of domestic violence who is sharing such um, tragic stories and difficult stories, and you're trying to figure out how to help them to be safe in a time when safety is at such a premium. And just some other things about mindfulness and visualization, and just the importance of taking breaks. We have to remind ourselves, and this curriculum did that because we were in front of the screens, because we were in some instances kind of glued to the TV, no, I'm sorry, the screen and the chair, if you will, that it's important to give ourselves breaks. Without having to travel, it was less likely that people were going to get up and move around and things like that from meeting to meeting, and that we had to really help ourselves by starting with our own bodies to be able to kind of manage our day, and to support the work that we're doing. Um, and one of the things that we got super busy after that training, unfortunately, and one of the things that Cathy offered that I definitely would like to take advantage of is doing boosters, because the pandemic is still going on, and we definitely need to continue doing the work. And I should just kind of, I wanted to take a minute to go back to the services that we provide, because I kind of skipped over that, just to give our attendees an idea of the work that's done by our staff on a daily basis. So we have our shelter. It's a 42-bed shelter. We had to reduce those beds to half because of social distancing. And then the other work that we do is training and outreach, and to lots of people who are, in need of our services. And then the in-person and group counseling that we do. One of the things I wanted to say, would we do anything differently? The one thing that I wish that we would have done sooner is a booster session, as I mentioned earlier, and that's something that I'd like to talk to Cathy about a little bit later on, to get that session again. I think what's next as my time is wrapping up, what's next for us is just to continue to check in with staff and continuing to remind them to breathe and to give each other grace. Those were two big takeaways that I got as we're working with victims who are experiencing complex trauma. And just to remind them of some of the other concepts that Cathy introduced during our training, and to continue to just employ those techniques and use some of the language that we learned during those trainings that were so vital to just helping everyone to navigate through this really difficult time. The thing that I'm really excited about is the fact that I do hear many of our staff using that language and referencing the concepts that we learned in the training. And so definitely it's working, and it's had a major impact on our staff and the way that we do our work, taking care of those who are in need of our services, but also being able to take care and acknowledge that each person that does this work is in need of being taken care of as well, and that important self-care. And I think my 10 minutes are up. And so
Oh,
then
thank
I'm
you,
happy to
thank
answer
you.
questions. You're welcome.
Yeah, thanks so much. And if anyone has any questions for Stephanie or for any of our panelists, please put them in the chat. And if we don't get to them today by the end of our session, we will definitely reach out and contact you directly. So thank you. All right. So our next panelist is from the New Mexico Coalition Against Domestic Violence. Rachel Cox, I'd like to invite you to go ahead and share what your experience is with using the curriculum in your state.
Sure, thanks, Kathy. And it's wonderful, Stephanie, to hear about all of the work, especially in the context of what today is looking like at agencies in Chicago. And so thank you so much for everything I'm sure you've been doing over these past years now. It's wonderful to be with everyone today. My name is Rachel Cox. I'm the Chief Program Officer with the New Mexico Coalition Against Domestic Violence. I've been with the coalition now just about 2 years, and prior to that, I was at one of our member programs, Domestic Violence Rate Crisis Agency. So coming to this conversation today with both that program work and now working at the coalition, and similarly have interacted with the National Center's core curriculum as an agency, and now am coordinating some of that work through our work at the coalition. And so just a bit about who we are. We're an agent, the coalition has 9 staff. We're a member-driven organization, so we have 30 member programs. Those are the principal domestic violence agencies across the state. And we also have 18 organizational members that we work with that are collaborative partners in our work, agencies like Legal Aid, things like that. And we've just recently started something called a Battering Intervention Program Network. Right now, that's a network comprised of folks who are working with people causing harm. And that's just launched a couple months ago now, and we're at 101 individual people taking part in that work across our state. So we're excited for some growth around that topic during this time. Our work with the National Center, it was wonderful to have an opportunity to talk about this today, because it put me in that moment of realizing that it's been ongoing now for 10 years, which is exciting and also hard to believe sometimes when you realize something has been a decade. But I think, you know, in New Mexico, there was a recognition that there were many local experts who had been doing DV and trauma work for a very long time. But as trauma-informed care was really emerging as a practice in our field, I think we were looking for an outside voice to really add a framework to move us beyond what might be just working with trauma. I don't want to say just, but working with trauma to actually being truly trauma-informed agencies across our systems. We wanted to be able to take people's experience of working with DV and SA and support them to reflect and identify and then implement practices that just hadn't really occurred to them without the opportunity of a truly like intentional training structure around it. And the National Center's core curriculum was really that. It allowed us to have an intentional, thought out training structure to providing trauma-informed, culturally responsive services in New Mexico. And so the center's core curriculum modules and the content have really, I'm just realizing, become a go-to training resource for us to be able to sustain our commitment as a coalition to working in a survivor-directed, trauma-informed way. I think something that stands out is that the core curriculum and the content in it, and then our interactions with center staff really support agencies, again, with that framework and language for what they're working with daily, but maybe hadn't been previously able to name. And we've just seen a really transformative impact for advocates to be able to, you know, name the impact of the trauma on the people that they work with and themselves. And also to be involved in a framework that supports them to explore the historical and present day power dynamics that are present in our work at our agencies, in our communities. Again, because I think we've been sort of swimming in that, but hadn't really had frameworks to name it, to give us a pathway to explore it in some of those more courageous conversations and start to really unpack some of the power dynamics that are present in our services, in our lives, and in our communities. So when we started in New Mexico, those 10 years ago, we really started sort of like with a whole state approach. All of the DV programs were trained in those trauma basics and foundational modules that Cathy had outlined in the beginning. The impact, and they were trained in the impact of DV work on advocacy and things like that. And it really laid one really wonderful outcome of that, in addition to many, was that us having that sort of backbone on trauma-informed care, culturally responsive work, we were able to really jump into a project that was called the Children's Capacity Building Project, which is something we received money from our state funder to do about 7 years ago. So with the existing foundation for trauma-informed and supervisory frameworks, we were really poised, I think, to work closely with the center on an initial foundational training for our children's programming staff who were working with parents and children impacted by domestic violence in our services. And so it was a real wonderful way that kind of just kept ballooning, that initial work kept ballooning. I think when looking back, both as a program who was experiencing the benefit of the training and looking at it now from a coalition perspective, those initial training years of focusing on the trauma foundations, the impact of the work on advocates, a real true primary focus for us started to take shape, and that was really focusing on supporting supervisory practices at our agencies, and really explicitly supporting reflective practice in the work of domestic violence agencies across the state. As we were listening to conversations around people exploring, power, trauma, all of the different things that are in the mix of our work, it was just really clear to us that to do this hard and challenging work, that as a coalition, we were responsible to contribute to the supervisory systems that were holding advocates across our state. And so much so that now that this has really just become built into the work that we do. We have it built into our budget to work with the National Center on annual training for supervisors across our state so that they can continue to reflect with staff around the work and how they're being impacted by it. Stephanie mentioned the idea of sort of some reboots or boosters and things like that. And so our model in the state has really become to regularly, meaning annually, provide foundational training around trauma basics, around substance use, around supervision. And then from that more like 30,000 foot view, sort of more broadly implementing these topics, we also support the programs individually. Sometimes they'll just reach out now because of our existing relationship, reach out individually to the National Center to be able to tailor work that's specifically needed at their agencies. Frequently, we see them individually engaging in this when there's been significant turnover, that they're struggling, if there's been a change in leadership, things like that, a moment where they're needing that extra support to come back to the reflective practice in their supervision and the foundations of the work that we're involved in terms of being survivor-centered and survivor-directed. When I think about anything we could have done differently, I would love to think about just like a really pre-thought out plan where we were going to just, move along in a really strategic way. But I think in reality, what's really important looking back is that the coalition at a state level maintained a commitment to these trainings and topics. And then as either inconsistencies or crises or turnover or whatever might have happened to slow the work down or sometimes speed the work up at agencies, we were kind of poised again to move at the pace of readiness of programs by maintaining that relationship with the National Center and the core curriculum topics, really being able to support programs as they individually needed it. And now with the impact of the pandemic, what we're really focusing on next is trying to get is a real focus on what kinds of levels of support are truly needed to sustain everyone in this work. People with many different identities in our advocacy staff being impacted disproportionately by the pandemic. What are the support systems really needed? And so we're starting some peer support groups and listening circles and things like that to really get at the true work that's going to be needed to support folks during these challenging times. So it's a lot, but it's been a lot. And I am really grateful to the National Center and open to any coalitions or programs from across the country that would want to speak more about the importance of partnering in this way. So we're grateful to everybody doing this work alongside us across the country. Thanks so much. I'll pass it back to you, Cathy.
Thank you so much, Rachel. And, for folks, again, if you have questions for Rachel, you're welcome to add things into the chat or, again, Rachel extended the invitation that you could reach out directly. So, each state has had a unique approach to, how they've gone about using the material, and our next state is Georgia. And I am going to invite Alexis Champion to share a little bit about their experience in Georgia with using the core curriculum and other training and what you found helpful. So Alexis, I'll turn it over to you.
Thank you so much, Cathy, and thank you, everyone. I'm really happy to be here today, and just really second so much of what Rachel shared. It's really great to hear what other organizations have done with the curriculum, and I'm just always thrilled to have the opportunity to highlight the curriculum and how helpful it's been to us as a tool. So we started using the curriculum, I think, really consistently in about 2015. And our initial approach was to take the modules and create a 3-day basic training that we spread out sometimes over a period of weeks. But one thing that we did that I really appreciated about this approach that was different from how we typically did training is that we created an application for the domestic violence programs in Georgia to fill out. It was pretty basic, but just a way to reach out to us to say that they would be interested in receiving this training from us on the trauma-informed capacity building curriculum. And we looked over the applications and tried to select the programs that we felt were really at the point of readiness to receive the information. And we're really committed to having their entire staff, from the executive director all the way to their night and weekend staff, present as much as possible, and those types of things. And so we would select 3 programs each year to work with and provide this training to. And so also different than just a standalone training where folks would come to us for one training and then go back to their programs, we would go to them and we would go for the first couple of days and do several of the modules, and then we'd go back for a 3rd day to do additional portions of it. But even beyond that, we would have follow-up with the programs. We would encourage them to put together a team from their staff of folks who were really interested in implementing some of the trauma-informed best practices that they'd learned about. And we would follow up with the programs to check in and see how things were going and were there ways that we could continue to support them in as they set these goals to become more trauma-informed as organizations. And so that was just a really cool process to be a part of. And each year, as we did the training with these programs, we would make adjustments and change things as we went along. And one, I think, really important change that we made with the second round was that we met with the leadership team in advance and had a conversation with them specifically about the process of change and how to engage in their staff, how to get buy-in from their staff, how to be inclusive in that process so that it was not just this top-down approach saying you will be trauma-informed. So trying to incorporate from a supervisory perspective how to be trauma-informed. And I will say that is one thing that I've always really appreciated about this curriculum is that it does not just talk about the trauma of the survivor. It also talks about the trauma of the advocate, and it really as much focuses on secondary trauma and self-care and the reflective process as it does of that outward look at a survivor and understanding the trauma they may have experienced, because I really firmly believe in the healing power of the relationship between the advocate and the survivor, and that it's not just a one-way path, right? It's a beneficial relationship for both people involved and for the organization and the organization with the community. And so I just appreciate the curriculums looking not just at the survivor's trauma, but the advocate's trauma and the organization's trauma as well, and health and healing, and how do we be healthy organizations, and how do we take care of ourselves while we're taking care of others. Some other ways that we have incorporated the curriculum in Georgia is, so we worked individually with those programs who applied, but we also contracted with a center in Cathy Cave to come out and do the effective supervision training. We have had that. I've lost count at this point. We just keep asking her to come back and do it over and over and over again, because it is so incredibly valuable and important. And I think for folks who are working in supervisory positions in our movement, oftentimes you start off on the front lines as an advocate working with survivors, and you get promoted to suddenly you're the shelter manager and you're supervising staff, and very few of us ever got coaching or training on how to be good supervisors, and certainly not through a trauma-informed lens. And so I just feel like that piece of this work is so incredibly important. That we have leadership who is deeply invested in the reflective process. And so that's been really important. And during the pandemic, being able to offer that training virtually was just a huge success. I think it worked really well. We had a great turnout. We had great participation. And it was obviously much needed, especially right now when you have this additional layer of staff experiencing the trauma of the pandemic and COVID. The other piece that we did with the center, and then we took that on our own, we had several trainings with where we combined both mental health service providers and domestic violence and sexual assault advocates within a community to train specifically on domestic violence and mental health. As I'm sure you all are very familiar with, there's that challenge for advocates working in the front lines with survivors, that they're oftentimes faced with survivors who are experiencing mental health issues that the advocate has very little training or expertise or knowledge to provide support around. And really, that's not their role, right? Their role, we want them to be good advocates and to walk with the survivor down their path of removing barriers and navigating court systems, and not focus so much on a person's pathology, but still for a survivor who is struggling with mental health issues, having support and effective services and knowledgeable services is so important. And so we brought those two groups together in part to provide that information in training session, but also to help them build relationships with one another so that the advocates weren't feeling like they had to take that all on their shoulders and try to be both therapist and advocate at the same time, that they would work to build partnerships in their communities, to really do wraparound services for survivors, to make sure that those needs were being met in as many ways as possible. So that's a quick overview of how we incorporated the curriculum. I don't have a head count of the actual number of people we've trained, but we have worked with 9 individual programs directly to go on site to provide that training. We've done review sessions with those programs. And again, we've had several standalone supervision and mental health trainings. I would say we've trained in the hundreds domestic violence advocates around our state on these different focus areas, which is really awesome. What we would do differently, I think, do a better job of using the evaluation tools that the center provides to really try to gauge the effectiveness of the training in the long term. We would send out the survey, but we weren't always good about doing follow-up surveys with the programs to see how it was panning out in the long run. And so I definitely am going to try to improve that moving forward. Our next steps, we do have 3 programs waiting in the wings, so to speak. We were trying to figure out how to transition and work with them in a virtual capacity. So we have been working with doing a refresh training for one of the programs we worked with in the past, and that's helping us to kind of figure out what this would look like in a virtual format. So we look forward to carrying that on to the programs, the next 3 programs that we'll be working with in 2022. And that is it for me. Thank you so much.
Alexis, thank you. Yeah, thank you so much. And, Again, if anyone has questions for Alexis or you want to hear more, please, reach out and let us know. All right. We are now going to turn toward Colorado, and we have two panelists from Colorado, Brandy Maliga and Miranda Encina. Really wanted to hear from each of you about your experiences and what your thoughts are around the core curriculum. So I will turn it over to Brandy.
Thanks, Kathy. We're both so excited to be here. My name's Brandy Waliga. I use she, her, hers pronouns, and I'm the Technical Assistance and Training Specialist here at Violence Free Colorado. So we're the state anti-domestic violence coalition. We used to be previously called the Colorado Coalition Against Domestic Violence. We have about, I believe there's about 48 or so domestic violence programs in Colorado. Not all of those programs are members of the coalition, but I'll explain a little bit more about how we support everybody. One thing I wanted to mention about our coalition is we have our coalition divided up into teams, as I think is pretty common. So we have our training and technical assistance team. We also have a housing and economic justice team, as well as a policy team and a communications and community impact team, along with our admin supports. So we all do technical assistance in different ways. And then Miranda and I both are specializing in some of the hands-on technical assistance. In terms of Colorado's connection with the National Center and our process with ACRTI, we kind of went a different route. And so we were initially our ACRTI work was initially framed through our FIPSA funder, the Domestic Violence Program, which is DVP in our state. And organizations who were receiving that funding, they were to set specific ACRTI goals. So choosing which of the 7 areas within the tools of transformation from the center, which goals they wanted to start working with. And so from there, it's also grown that organizations continue to set more and more ACRTI goals. So that supports their own organizational practices and their own structures, and expanding those through the accessible, culturally relevant, and responsive and trauma-informed lenses. So we support the domestic violence organizations around the state with helping them do that. Like, a lot of what we've noticed is a lot of programs are already doing so much work that falls under the ACRTI lens, and may not call it that. They might not label it that. So that's one of the big pieces that we are able to do, is to support programs around understanding what they're already doing and maybe how to keep working a little bit more on those things and keep honing in the goals that are specific to them. For us, we really started out with with the National Center coming in and conducting in-person trainings. And in the spring of 2019 is when we started that. And actually that meant our coalition staff, some of our coalition staff, and some of the member programs and other folks who came to the trainings, we were all learning side by side. So it was also kind of a unique experience. We felt that, as coalition staff, we were trying to get our bearings with understanding all of the different resources and the modules. It was amazing. And also I could tell too, like, wow, this is a lot. It's great. It's amazing. It's a lot of information. So it's kind of a neat situation to be able to learn alongside some of the programs. So we started off with supervisory training. That really set the stage and also really whetted people's appetites for having this material, learning more how the National Center works and how they share out the material. So we did, that was spring of 2019. And then we, later on, late summer of 2019, we were able to bring Cathy and Gabriella out to do the kind of a 3-day core curriculum and the mental health and substance use modules. And those were also in person. And then over time, we've done some more web-based training. So the virtual trainings were on all 3 specialty modules, and those were at the beginning of this year. So we've noticed that programs are really, really hungry for all of this information, especially around mental health, especially around substance use. That's one of the pieces that we keep noticing over and over, and we've been able to share that information out and keep providing training and technical assistance on specific questions that come up for folks about the core modules as well as the specialty modules. and to keep bringing, we also have a big desire to keep bringing the National Center staff back for more and more trainings because people love them. Right now we're focused on framing all of our technical assistance and training through the ACRTI lens. That's our organizational goal, which means that we're also in the process of having the rest of the staff, not just the TTA team, to learn more about the National Center's model and trainings and all of the pieces that are related to ACRTI. We've been able to share out toolkits. We've been able to share out all sorts of information through different groups, whether that's through a Basecamp group or a different email group. We've had a lot of information sharing, and even through COVID, we've been able to, really keep making those connections about, again, how are folks doing the work that they do, and recognizing, how they're doing it and how they're doing it well, and supporting them in that, and giving them kudos along the way. I'm going to go ahead and hand it off to Miranda to explain more in depth some of the kind of boots on the ground work that are happening right now.
Awesome. Thank you, Brandy. I really appreciate kind of all of that foundational groundwork that you had mentioned. Thank you, everybody, for being here today and sharing space with us and being witness to the things that we are doing, right? All of this is kind of a work in progress at times. As mentioned, my name is Miranda Encina. I use they, them, their, and she, her pronouns. I'm the Culturally Responsive Technical Assistance Specialist with Violence Free Colorado. In a nutshell, what that means is that I work with organizations on in the state of Colorado on how to be accessible, culturally responsive, and trauma informed, and what that actually means in policy and protocol. You'll hear us say a couple of different things: the ACRTI, ACRTI, accessible, culturally responsive, trauma informed. I had written it in the chat so that when we're talking about those terms, that's what we're using. My position specifically was created as a brand new position since February. And so my position specifically really works with the Tools of Transformation toolkit to be able to think about ways that we can incorporate that and support, as Brandy had mentioned, organizations here in the state of Colorado. So that could mean a lot of different things, right? I think oftentimes when we talk about accessible, culturally responsive, trauma-informed practices, it's such a wide range. It's such a wide lens, and it encompasses everything. And so that can be a difficult thing to create goals around, or to know where to start and how to start. And so our role is to kind of help ease that a little bit. I'm also new to the Tools of Transformation, the toolkit from the center, and so I'm also learning as I'm, in this role and working alongside organizations. So a couple of things that I've been able to do with this curriculum specifically. One, I think the main piece is build connections and community. I think that's been one of the biggest pieces that has been really helpful for me. After hearing some of the panelists talk, it really just brings comfort to me knowing that a lot of them I've been in collaboration and connection with, mostly around how do you use this tool? What does it look like in your community? What are the specific conversations that you're having? What are the barriers that you're having, right? Because I think that when we're talking about trauma-informed practices, there are so many different ways that can play out within our organizations and what that could look like. What we know about domestic violence is that historically it's been framed in a lens predominantly of a very Eurocentric, white-centric models and systems and survivors, and oftentimes left out a lot of communities. So what I appreciate about this tool is it really kind of puts us in a position to expand the way that we talk about that, the way that we talk about trauma, the way that we incorporate generational trauma, 4 eyes of oppression, all of these different pieces that really allow us to meet survivors where they're at, right? Because without those lenses, it's really difficult for us to oftentimes be with survivors and know some of the barriers that they may be having in their world, and be able to be witness to them. So I've really loved seeing how other communities, especially nationally, have used this tool specifically, right? I've been able to witness some of them, ones that are specific to Indigenous communities, and how they incorporated this Tools of Transformation, and being able to then okay, how can we incorporate this into the work that we're doing? So I work with, specifically, we created a Recentering Resilient Communities Collaborative. And so it's about 3 organizations here within Colorado who are members. There was an application process, and there's about 2 to 3 participants within each of those organizations, and we're doing a 6-month-long collaborative to really kind of go through some of the pieces of this tools of transformation and how this is applicable within their organization, right? I think a lot of organizations really want to be centered in how do we support survivors, right? But really the help in being able to know what to do around that. Some of the areas that I have really wanted to grow this toolkit specifically is really focusing on specific communities as well. So I'll do a lot of trainings around gender inclusivity and how do we use pronouns in shelter, and what does it mean to be, accessible, culturally responsive, and trauma informed when it comes to supporting trans and non-binary survivors, when it comes to talking about racism and how do we support ourselves, but then how do we support each other and survivors and organizations. So that's what I really appreciated about this tool, is it opens up conversations to be able to do that and have that reflection piece that's really necessary in the work that we're doing. And then, and additionally, one thing that I began to notice with working with organizations in our state and connecting with organizations nationally is how can we support each other nationally? So we also created a equity collective, a monthly equity collective, where organizations who have used this toolkit in some capacity connect about what went well, what areas of growth do we still need, what kind of resources can we support for each other, and provide, there's specific videos around depression, or there's specific videos around social justice, articles that we need to be reading, playlists that we could be using, and centering specific communities in kind of this resiliency process. So those are some of the areas that I'm really excited to continue working with this Tools of Transformation Toolkit, and to learn more about what that actually could be for our community. So thank you again so much, everybody, for being here, and know that we're always here for resources if you need anything. I'll go ahead and send it back to you, Cathy.
Thank you, Brandy and Miranda. Thank you so much for sharing. And again, if anyone has questions for Miranda or Brandy, please go ahead and put them in the chat. And again, if we don't answer your questions today, we will respond to you directly. All right. And last but certainly not least is the Pennsylvania Coalition Against Domestic Violence. And from the Pennsylvania Coalition, we have Jessa Winus. Jessa, I'm going to turn it right over to you.
Awesome. Hello, everyone. My name is Jessa. I use they, them, their pronouns are my name, and I am a training technical assistant specialist at the Pennsylvania Coalition. Pennsylvania is the first domestic violence coalition in the nation, which is exciting. We are a pass-through funder. So we fund 59 programs that serve all 67 counties in our state. And we also, offer a very large list of different types of advocacy responses and services. So with the idea in mind that we are a pass-through funder, what we really wanted to do was really define out what we meant by trauma-informed, right? We've heard a lot of that in our field over the years. We have a funding standard that's adherent to our programs providing trauma-informed services. And they said, what does that mean? So I did some research, and I was in a learning collaborative through NCDV with the National Center, and reached out and asked what they knew about any options outside of sanctuary, because that wouldn't be a good fit for a coalition our size with the vast needs that we had, and we were introduced to the core curriculum. We had a lot of turnover in between, initially, getting involved in the project and learning about it. But eventually what we did was we created an internal team at the coalition, myself, 2 folks from our prevention team, 2 members of senior leadership, and then we also have 2 executive directors from program on our training team as well. And what we did was we planned an a core rollout. So we did a rollout for all of our programs to partake in. We divided it up and we did by region. So we have 3 regions, Western, Eastern, and Central. We opened up 1 session per region per training. So we had 3 separate rooms going at a time with 2 trainers apiece for 3 regions. So we had a lot of training moving from January all the way through June. We offered the initial core curriculum trainings, and then we also did, for the folks that completed the core, we also then did the specialty modules, and we were all trained as a team prior to releasing it to our coalition programs, to our delegation, to our membership, by Cathy and Gabriella, as well as Susan. So they came, which was exciting. So we got some TOTs. We also then adapted it to what we needed. And then can anyone hear me? Okay, I see a yes. I don't know what happened, but I see the chat and now I panicked. Sorry about that, everyone. But yeah, so we completed the core with 50% participation on average. Moving forward, our plan is to, Cathy is going to be joining our coalition to do quarterly trainings for the supervisory modules that build up into our in-person conference next year. And then we're also doing another core rollout, full core rollout, beginning in January to get all of our programs trained. So I'm really excited about that. We're also starting quarterly calls for folks that completed the core to come together, kind of like a baby version of the Equity Collective that Miranda had mentioned, where we can share best practices amongst each other for programs, see what PCDV as the funder can do to help, and also use the ACRTI tool to guide the conversations, focusing on each sections of the tool and helping programs along, sharing and elevating the work that they're doing on it. In terms of barriers, the biggest or things that we would change, honestly, I think doing work with supervisors and EDs may have been more beneficial at first because a lot of the feedback that we got in measuring in our evaluations from the core rollout was not having senior leadership or upper management support in implementing this type of work, these changes, and utilizing the tools. While we are now working on that, I think that as a team, we all think that that might have been a better approach to start with supervisors, get their buy-in, then introduce the core. But lesson learned, it's okay because we're going to start doing it now. And I know that we have a lot of buy-in from a lot of EDs this time around. We also had are going to have our 2 executive directors on the training team write letters to give out to the delegation to share how important this core curriculum information is, how meaningful the tools are, and what positive things have come out of implementing it in their own programs. And I will pass it back to Cathy.
of the things that I wanted to say, while we have everyone, is how much, this was true for each group that was used, that you all have made a contribution back, but you specifically honed in on some very specific feedback around the mental health module and around conversations to have, and that has been incredibly helpful. And so I just wanted to say to everyone that, along the way, while the center has created and disseminated this curriculum, we are constantly and continually hearing back from folks, making adjustments, sharing out examples, and finding new ways to share information. So what's coming up as a result of all of this work, and we'll be doing webinars for the next few months. We'll do one a month, and we'll do an overview and kind of highlight key aspects of each of the modules. So join us next month, and look for a notification that comes out that will have all of the dates and all the topics, but we'll do an overview of each and every one of the modules for everyone. And I wanted to thank our panelists today for your participation and for sharing so much and for teaching me so much. I'm really appreciating each and every one of you, and thanks again. So I'm going to turn this over to Carla.
Thank you, Cathy.
To close this out. Yeah.
Yes. Thank you so much, Cathy, and thank you to all our panelists for today's webinar. Thank you to everyone for joining us today. Within the next week, you'll receive a follow-up email with a recording to this webinar, in addition to the slides, so it's just useful to have, and a certificate of attendance with an evaluation. Thank you again for joining us, and we hope you have a wonderful afternoon.